think it's really important for women that they know their midwife, and that is very, very important. And we know that improves outcomes for women in their pregnancy as well. So at the Coastal Birthing Unit here, we run a hub, and in our hub we have a group of midwives that are allocated a caseload of women, and those women we will then caseload throughout their pregnancy, so they get to know us and we get to know them as well. And that is really important for good outcomes in pregnancy. The hub here is really, really important because it gives us a base to work from. So it's really important that the women have ownership of this hub as well.
Having a community midwife throughout the whole of my pregnancy, I have fortunately, I've had the same midwife throughout. The continuity of care, the rapport, you've got more one-to-one, and also I think it's your midwife knows you, knows your baby, and you just feel more reassured with that. Hi, come in. Good, thank you.
Women need to feel comfortable where they have their babies and where they give birth, and we know that being at home, being in your own surroundings, with your family, being able to just get up and go and make a cup of tea or coffee, those sorts of things if you want, is so important to that experience as well. So it's something that we actively encourage, and as midwives as well, we love going out and to people's homes where they have their babies. It's a lovely setting, and we always encourage that.
Here at the Willows, we've been offering postnatal and antenatal services throughout lockdown. We phone the mums at 16 weeks and 24 weeks. They're seen at the hospital at their scans at 12 weeks and at 20 weeks. We then see them regularly from 28 weeks, myself and 2 other colleagues that do clinics here every day. We have a clinic, we have a postnatal clinic as well here. We're doing a first visit at home, as it's really important to check safe sleeping and that the babies are safe at home, and give any advice mums need. We have breastfeeding clinics if women need breastfeeding support. We give them a date to come back here at 5 days and 10 days, around those days, to do the newborn blood spot at day 5 and weigh the baby, and then discharge into the care of a health visitor at 10 days.
Here at Bluebird Lodge, we opened actually in 2005 and were commissioned to provide rehabilitation for patients in our local area. Over those years, we have changed radically. We've tried to keep up with the needs and the demands of the service and our local population. In November 2017, we became known as the STAR Centre, Short-Term Assessment, Reablement and Rehabilitation Centre. Patients come here for up to a period of 2 weeks. We carry on their rehabilitation, we complete assessments, and the idea is that people continue their rehabilitation journey once they're back at home with our community therapy colleagues. There's a lot of work being going on in the background and in the forefront. Community transformation. We've got the integrated neighbourhood teams, ways of working more closely with our social care colleagues. It's all about keeping people in their own homes. That's where people want to be. They want to be in their own homes where it's more familiar to them, and hopefully then whatever illness they may have suffered with, they'll make a more quick recovery.
You're in hospital, you know you're on recovery, you know you're getting better, but you're also consciously aware that you're not ready for home, and nor can you see how you're going to be ready for home. Whereas you come into an establishment like this, which is geared up to actually getting you ready for home, and you can immediately see the steps they're taking to actually get you home. And you're working to a common end. You want to go home, but you don't want to sort of go home until you're ready to go home. And they work amazingly at getting you ready, and all the problems that there are on the way they try and overcome, I think, quite effectively.
Here at ESNEFT, our allied health professions have been collaborating with colleagues across the system to address the post-COVID needs of our patients, which include ongoing respiratory issues, memory problems, muscle weakness, fatigue and low mood. So we've been developing a pathway to ensure that we are meeting those needs for our patients and supporting them through their longer term recovery.
Hello Nancy, it's Fiona here from the therapy services at the hospital. So what we've done is that we've contacted all the patients that had been through the trusts, both Ipswich and Colchester, with a diagnosis of COVID, phoning them up and going through a set questionnaire that we've developed, which will cover the issues of fatigue and breathlessness, dietary needs, cognition, function, excitability. And that will give us some data that we can use to see how they're progressing, but also it will give us a database of all the needs of patients. Should we get a second spike again, we can address our needs to what these results show us.
Our aim is to empower our patients to manage their own healthcare needs by signposting them to the right services, but also providing them with the information they need through the development of a patient leaflet. This leaflet gives them advice on exercises, breathing techniques, managing fatigue, how to train their memory, and it really helps them to manage their ongoing symptoms.
Thank you very much for all your help.
No, that's been a pleasure. It's been a great opportunity to work across health and social care, acute and community, and we've developed lots of relationships that we will continue to work with.
We've had some really good feedback from our patients. They find the phone calls very supportive, and it enables them to access the advice they need in a timely way. But we're also empowering our patients to manage their symptoms and be very involved in their recovery.
The INTs are local health and social care teams set up to provide local care for patients in their own homes, in localities, out of the acute setting, to kind of make it more personal to them.
She's not eating as much as she used to.
We set up local healthcare and social care calls to support the agencies locally. So the three main agencies we have, 4 weekly calls to discuss their 10 key patients from a health point of view and a social care point of view, with therapists and social workers and OTs on that call to discuss the holistic care for that patient. It provides the agency with support during this unusual time. It provides us as a way of preventing things escalating too quickly. We can get in there early without referrals coming in. So as a way of kind of looking after the patient locally, rather than waiting for the systems and the referrals to get to us, we can kind of get in there quickly. And having that joined up approach, it's only that one discussion from the patient. They don't repeat themselves 10 times. That one conversation should get spread between the team. We can act on that and treat for them and care for them based on that one joined up team. This has helped us to increase our awareness and rapport with our local INT team, our integrated neighbourhood teams locally, and primary care and social care, care agencies, the hospice, you name it, it's kind of been a big part of that. And this is one example of those ways of working.
My name's Deborah, I'm a community nurse based with the North East community team. We're really multi-skilled in the community. We do anything from diabetic management, end-of-life care, a lot of wound care, just about anything that keeps people out of hospital. Hospital can be a very confusing and disorientating place for them, so if we can provide care in the community that keeps them as independent as possible and out of acute care, it's better for them. We're sort of very holistic in our approach in the community. We get to know our patients very well. And so, you know, we're aware of their family situation, everything that's going on with them, so we're best placed really often to keep them out of hospital. A lot of elderly people don't want to go to hospital, they prefer to be at home. They've often got a lot of support networks in the community, and if we can keep them sort of safe and independent at home, it's less traumatic for them.